morning, good afternoon, good evening, dear colleagues, everyone listening to my voice. My name is Professor Sunday Olajide Awofisayo. I'm a clinical pharmacist, and today I'll be talking to us about pharmaceutical care. This presentation will also serve my students and also a refresher to my colleagues. And so what we're talking about pharmaceutical care today, we look at the principles and concept of pharmaceutical care in terms of the definition, the evolution, the history of pharmacy practice. We also be discussed in this webinar. So we will look at patient-centeredness in pharmaceutical care in depth. The learning objective include defining what pharmaceutical care and explaining its core principles. We also look at the historical evolution of pharmacy practice over the years, and then we'll explain the transition from one point to the other, as in from product orientation to patient orientation. The learning objective still includes explaining the relationship between pharmaceutical care and therapeutic outcome. And all of these things are what we're going to talk about, even in the next 20 to 30 minutes. We also stop and talk about the barriers to pharmaceutical care. Why are we not having excellent delivery of pharmaceutical care in our system? What are the itches that we have? And then finally, how do we apply pharmaceutical care principles in clinical and community pharmacy settings, in the hospitals and in the pharmacies that are all around us, that serve as a primary healthcare center to many people, right? So by way of introduction, healthcare systems globally has evolved from disease orientation to patient-centered care models. And so pharmacy also has followed suit. So we are looking at how our patients get satisfied, how they get the best from our care. We may want to care about the drugs, yes, keep it safe, keep it well, and all of that. Yeah, because we know those things will help us serve our patient better. But we want to also put more attention on the patient, look at their quality of life, how has it improved, and all of that. So pharmacies are no longer limited to dispensing medications. We do that, yes, is our core, yes, but we want to pay attention more on how this patient can get the best from the drugs they are taking. So pharmaceutical care represents the most important paradigm shift in pharmacy practice. Principles and concept of pharmaceutical care. Number one, we want to define pharmaceutical care, and that is the responsible provision of drug therapy for the purpose of achieving definite outcomes that improves a patient's quality of life. A responsible provision of drug therapy for the purpose of achieving definite outcomes that improve a patient's quality of life. And when we say outcome, that includes the cure of that disease that the person is complaining about, elimination or reduction of the symptoms that led us to believing that this person is not comfortable and need help, then arresting or slowing down the progression of a disease. That the person has been having convulsion up to 3 or 4 times a week, we've been able to manage it to maybe once a month. That's arresting or slowing down the progression. And then prevention of diseases or symptoms from even starting in the first place. And so all of these things are all embodied in pharmaceutical care. So as a pharmacist, I want to ensure that I help you get better. I help you from even contacting a disease in the first place. And, that's a complete cycle. So the core principles of pharmaceutical care include patient-centered practice, responsibility for therapeutic outcomes. If you serve the patient well, then the patient will put the thumbs up for you. And so we want to pay attention to our patient. And when we say responsibility for therapeutic outcomes, yes, therapeutic outcomes means outcomes for drug-related interventions. As the pharmacist, we want to be responsible. We don't want to say, I didn't do the diagnosis, I was not the one that administered the drug, and all those alibis. As a pharmacist, I want to ensure that the drugs this person is taking agrees with the diagnosis that was made. And whoever is administering the drugs, I want to help the person to ensure that the drug is rightly administered. All of these are still under patient pharmaceutical care. So as part of pharmaceutical care, we want to identify and resolve drug therapy problems. As in, there's a problem already due to using of a medication. I want to step in and see whether it is overdose, was it underdose, or is there an allergy, is there any medication error or something. So all of these things are still at the purview of the pharmacist. And as a pharmacist, I don't want to carry ego. I want to encourage interprofessional collaboration. No matter how difficult any other member of the healthcare team might want to be, I want to bring them together. Soft words turn away rough. Bring the physician closer to myself. Bring the nurse to be a friend. The lab scientist, let them be just right there, so all of us can work together. And why must this be? Drug is at the center of the healthcare operations, and I'm in charge of drugs. And so I'm going to stoop to conquer and be lively and be sociable. Bring everyone together. Let's make it work. And that's part of being responsible for therapeutic outcomes. Then continuity of care. I also want to ensure that patient is maintained throughout treatment. When are you supposed to come back? When are you supposed to see your physician, or maybe your dentist, or when are you supposed to come back to the lab to take another test to see the progress of treatment? So all of this, I want to ensure that they are in place. If they're in place, then I am certain that the outcome we are looking for will certainly be there. So the component of pharmaceutical care include patient care processes involving patient assessment, identification of drug therapy problems, developing of a care plan, implementation of interventions, and monitoring and follow-up. So the plan the physician has is not my own plan. He is making a plan from the medical point of view. The laboratory scientist too has his own plan. Yes, the nurse too has his own plan. I, as a pharmacist involved in pharmaceutical care, I have my own plan, and I call that one my pharmaceutical care plan. And so, and the goal of my plan is to ensure that the outcome of therapy is as planned. And of course, that involves what we don't do. And what don't we do? Follow up. Follow up has been a problem. We really send patients from the hospital back to their homes and follow up on them, call them, are you taking your medications, how's the adherence pattern? Once we say come back in 3 months, the fellow comes back in 3 months, but he has not been taking the medications. This time he's coming to complain that the situation is worse. And like I said earlier, I want to be responsible for therapeutic outcomes. So that outcome we have there, I'm responsible. I didn't follow. I didn't even know whether the patient is taking the medication or not. So what are the goals of pharmaceutical care? Improve therapeutic outcomes. Have we not noticed that people are using drugs and we're not getting results? If pharmacists will step up, and of course there are many predictors to therapeutic outcome being at the low head. We will not waste time on that. We want to promote medication adherence. Not all the drugs taken from the hospital to the house are actually taken. People have a pile of drugs in their houses. They didn't complete them. They felt somehow and thought they should discontinue. All those things are just there. And those are results of insufficient counseling and all of that. And I give an instance here. Somebody discontinued using rifampicin because the following morning, after taking the first dose, the toilet was stained. Say, Jesus, I'm dying. Whereas if they had told him that it will discolor your urine, he would have been calm. The guy probably felt the tissues were lysine and all of that. Okay, so if you optimize medication use, we get the results that we are looking for. And then people's lives, they should be more satisfied. After coming to the hospital, they had an expectation, that's why they came. So getting back home, somebody should ask them, are you getting better? Are you sleeping well? Are you eating better now? That's why the complaint the person came with. And so we want to, make findings, want to get the feedback on all of those things. And it seems all this I'm talking about, nobody has time. Everybody wants to do some other things or look for money and all of that. But the truth is, money will just come naturally if you're doing the right thing. And so some persons get prescriptions that they can't afford. Whereas there are drugs that can do the same, they are about available and about equivalent. And so we can change, we can switch to a more cost effective medication. All we want is to get the result. Or what is the point? Taking a prescription that you cannot even buy. Do we get results? So let's use what will help the person be able to cater for other things. And the body, the financial burden is lighter. So traditional pharmacy practice was what we had many years back, and that involved pharmacies, doing the drug preparation, compounding, adding this, calculating percentage weight and volume, and all of that, and then powder packing them individually and all of that. You need those, for each of the clients, and like we said, healthcare is becoming very complex, and so we can't continue to do that. Okay, and that was why we came to the industrial age where the industries have to mass produce. And to mass produce, you don't need many pharmacies to be in there to do the mass production. Is the equipment that will do all of that. So in the ancient era, herbal medicine preparation, cold drug formulations were the key kind of formulations we had. And pharmacists concentrated on those things. They were product oriented stuff. Example of Egyptian pharmacy, Chinese medicine, Greek medicine. These were product oriented, and then they belong to that ancient practice. And that was from 1800 to 1940 period. Okay, so like we said, the major responsibilities of pharmacists were compounding, dispensing, storing the drug in the appropriate place, having enough space for your stock to keep the drug so you can give enough. You are not out of stock, another kind of they are very lofty things. But we moved from there to the industrial era, 1940 to 1960. Then emphasis of pharmacy shifted from compounding to dispensing manufactured drugs, because only few pharmacists were involved in the industrial production of drugs. So the rest of the pharmacists were more on dispensing, making sure that the dispensing is right. You don't give a wrong drug to another person and all of that. Okay. And now we move from then to the clinical pharmacy era, which is 1960 to 1980. There we believe that the clinical pharmacy needed to come on board because of increased drug complexity, and there are so many drugs, different classes of drugs. For example, there are about 12 classes of antiviral drugs, 12 classes of antidiabetic drugs, about 10, 11 classes of antibacterial drugs. And so we believe that the way these drugs are just multiplying in their number, pharmacists will need to be available to be able to help guide how people take these drugs, so we don't have drug-related problems. So there is need for medication expertise, and that was what the clinical pharmacy era, ushered in. So pharmacists became involved in the hospital round, drug information services, therapeutic monitoring of drugs. Even though we say therapeutic monitoring, that has yet to pick up in Nigeria. Let me say Nigeria because I've not really explored other countries in Africa. And if we keep giving drugs, if physicians keep prescribing, and we don't even know whether we are actually eating the therapeutic range, are we not just being funny? And we need to just up our game. That is what we're talking about. And some drugs have actually caused a lot of fatalities because we didn't know we've reached the toxic levels and gone beyond. And then we have a case on our hands. And then we try and say we have a death secondary to this and that. Whereas it's not secondary to that. It is secondary to drug overdoses and all of that. So the pharmaceutical care era emphasizes patient-centered care, accountability for outcomes, and direct patient involvement. Yes, the pharmacist wants to see the patient and talk with them. even though we have a lot of itches and barriers to that already. The patient are in a hurry, or the number of pharmacists to patients is not just right, and so there's a burden, there's a burnout, all of that. Fine. But we need to know the problem so we can actually solve it. So modern pharmacists now provide medication therapy management, MTM, pharmacovigilance, chronic disease management, and preventive healthcare services. I take a pause and talk about chronic disease management. Yes, we pharmacists limit ourselves and put ourselves in a box because some clauses here and there says that pharmacists can only manage simple ailments, minor ailments. Yeah, that's the word they use, minor ailments. The truth is, most pharmacists in community practice are actually managing chronic ailments. We're only asking that they up their game in terms of knowledge and skills so that they can help. Because if all these cases community pharmacists are managing surreptitiously, if they have to all turn to the hospitals, then there will be no space for anybody to pick a pin that drops on the floor. And so pharmaceutical care area has actually brought us to handling chronic disease cases in terms of if they're taking a medication from their physician, we want to help them fine-tune things. We want to be sure that the drugs, which in most cases are up to 4, 5, 6, 7, are taken rightly so that one does not affect the other, and at the end of the day, result is not there. And that's the part of that definition that says a provision of responsible care. And the pharmacist wants to be responsible for drug related outcomes. The factors driving evolution of pharmacy practice: increased drug complexity, rise in chronic diseases, drug-related mobility and mortality, advances in pharmacotherapy, need for medication safety, and healthcare systems reform. So let's talk about pharmaceutical care as the professional practice. Pharmaceutical care is now recognized as a professional mission of pharmacy practice. At the time in Nigeria, there were some dragging foot, but now all the institutions are now looking at PharmD, clinical pharmacy, doctor of pharmacy. Even though there might still be some issues with implementing and maximizing the impartation on the students, but I know we'll get it right by and by. So we want to talk about what pharmacists do in this new dispensation. Why are pharmacists giving that professional recognition, and the value of pharmacists in the healthcare and the value that they provide in the healthcare. I think other healthcare members, especially those who hold the vantage position, should be made to see that there is no need for us to fight. We can agree together, since we all have one common goal, the patient, the wellness of the patient. Then we can work together from our different angles. If it happens in developed countries, it can happen in our own country. So the pharmacists should be seen and known and should hold themselves out as responsible for medication appropriateness. This prescription, is it appropriate for this person? Even with that, somebody who wrote the prescription, I think, are you trying to no, that's not what we're saying. What we're saying is it okay for this person? I'm only here to help you. We're human. Even machines have their efficiency. They are not probably up to 100%. And so anybody can make a mistake. And the only thing I'm going to say is, oh, pharmacist, thank you. I didn't know. I just, that's okay. Nobody's going to run you down. So the pharmacist, as part of our pharmaceutical care duties, is to ensure that medication is appropriate. So every prescription that you have, before the drugs get to the hand of the patients, the pharmacy should vet it, not as a kind of correcting or teaching. No. Two heads are better than one. That's how they say. And then therapeutic effectiveness, then medication safety, because what Mr. A is taking might harm Mr. B for one reason or the other. Then adherence support. The position is already out from the physician. The drugs out too from the pharmacist to the patient. At this patient, they're human beings. Anything could go wrong, one thing or the other. And the pharmacist should ensure that the patients are adhering And then before they actually leave the hospital, and even after, counseling, education, post hospital visit, follow up, monitoring outcomes, and all of that. A lot of work indeed. Yeah. So medication therapy management is just one of the key roles of a pharmacist in pharmaceutical care management. Then identification of drug therapy problems. This complaint that this person is coming up with has to do with a particular drug. Some persons might be taking a drug that is causing itching, or a drug that is making them have cough. And what somebody might want to do is to prescribe another drug to stop the cough. Whereas this patient is still on that. For example, some blacks actually have cough, taking angiotensin converter enzyme inhibitors, example is Sinopre. And so you might have to step that down. Some patients have ankle swelling using calcium channel blockers like amlodipine. And so if that is there, should you now start prescribing furosemide to drain the leg and all of that? Is to probably switch the drug, discontinue it, look for an alternative and all of that. And so these are things that a physician and a pharmacist can discuss together, if they are friendly, if they are one, and if indeed they know that the health of the patient, the outcome of treatment is a key. So overdoses, other drug reactions, non-adherence are all under drug therapy problems, and a pharmacist should be able to help handle those cases. Then patient counseling, educating patient on drug use, the side effect, storage, adherence. If we talk about side effect of drugs before we hand the drugs over to the patients, they are not able to note it and act accordingly or appropriately. But if they didn't know, they probably discontinue and they don't even get back to you. If only they call you and tell you, which in most cases they don't have there's no link, there's no telephone number to even call back. You can see the kind of healthcare service we are providing in our client care. So benefits of pharmaceutical care for patients, it improves health outcome, it makes medication adherence better, it reduces adverse effects. For healthcare system, it reduces hospitalization and every burden of work on the healthcare system, reduce healthcare costs and improve quality of care. Then for pharmacists, it gives us an expanded professional role, increased recognition, and greater clinical impact. What are the barriers to pharmaceutical care? Inadequate staffing. For a pharmacist to counsel up to 30-40 patients, that's even more work than when a physician has to write prescriptions for that number of persons. Or if we are not going to start arguing, they have the same level of work. And because as you're counseling someone, questions come up, you answer the question. Counseling is not done in a hurry, and you must try and get the perspective of your client so you can know how to put things the right way before the person leaves. And I think we need more staff to be able to do that. And then poor remuneration, and that's a general problem in Nigeria or in South Africa. Limited clinical training. Yes, pharmacists will need to do more trainings, get more certifications in terms of skills and all of that, not depending on the PharmD, the 5-6 years exposure in university alone. Every year, 2, 3, 4, 5 times, attending this conference, this seminar, this and that will increase our competencies. Then lack of collaboration. We like to do things on our own. We have our colleagues who can help us, or we can relate together to give a better stand. Then time constraint. Certainly there's no time to do most of the things we've been talking about. And then our documentation system is very poor. There's no light to power the computer, so that when this patient comes, we can even know what we discussed the last time, and then documentation to know what we didn't do or we left off, and all these things are all just important. So our system is not just right, and so most of the medication errors we have are attributable to system failure. But we try and point a finger to that person And so what we're saying in systems, whatever, is that we're not looking at who did this, who did that, and did not do it well. We are looking at what did we not do as a system that is making and we still make things to go the other way. Importance of patient-centeredness improves adherence, enhance patient satisfaction, reduce medication error, improve therapeutic outcomes, strengthens trust. Once we do things well and our patient gets well, they have a better perception of our services and they're satisfied, then we are rated high. And so, we talk about communication in pharmaceutical care. Effective communication includes empathy, counseling, cultural sensitivity. All of these are still what we can learn in seminars and even get certified for them. Because the way you're going to counsel someone who is a Muslim might be slightly different from someone who's a Christian. And even among the Christian folk, there are still some persons who don't eat fish. Maybe they say they are Sabbath or a particular fish that does not have this or that. And so when you say fish oil, or when you have some capsules that are made from pig, pork, I mean, Muslim, I don't take a capsule because they contain, and you don't even want to accept that, then you're not going to get the cooperation. So, future of pharmaceutical care, we are looking at establishing a pharmacy and pharmacogenomics, individuals and their particular genes, or maybe those from acquired born, those from or a BPO. There might be some pharmacogenomic decisions that a pharmacist will need to look at and know where you're from. We take all this information when you come to the hospital. Where are you from? What's your tribe? What's your age? What's your this or that? Those things should help us personalize precision medicine, digital health monitoring, expanded prescribing role, and crowned with artificial intelligence. And so my colleagues have to also take courses in AI and see how AI can make their work simple. And because we're going to be found out if we are using manual capacity or competencies to handle modern day job demands, it will not work. So, distinguished ladies and gentlemen, that will be the little we can bring to us today. We can check the slides and see some interactive assignments that you can submit back to me so we can discuss more. Thank you.